does specifically admit covered entities, including hospitals and healthcare providers, to share information that is directly relevant to the involvement of a spouse, family member, friend, or other persons identified by a patient in the patient's care or in the payment of healthcare or in the payment for healthcare operations. So if a patient has identified somebody, they can be involved with and release that information. However, the HIPAA rule also provides that in an emergency situation, a healthcare provider may also share relevant information if the patient cannot give consent when a healthcare provider or hospital or plan representative believes, based on professional judgment, that sharing information is in the patient's best interest. So HIPAA has always allowed for this. A couple of years ago, I attended a conference at the Department of Health and Human Services, and Roger Savino, who is the director of the OCR, and the OCR is the branch that enforces HIPAA, he made a very astute comment, and he said they have never found a hospital or a provider for speaking to a friend or a concerned person about the patient's condition when they use their professional judgment. And that Roger Savino said they believe that professionals always use professional judgment in this. So again, just follow the regular HIPAA rules and you should be fine.
Thank you, Michelle. That makes a lot of sense. Can you please explain some of the major differences between whether an employee who has been laid off by their employer should file for unemployment or paid leave? Could they do both?
This is a really good question, and it was actually answered by the Department of Labor last week, last Friday to be exact. And the Department of Labor said that laid off employees or furloughed employees are not entitled to the 2 weeks of sick leave or the expanded family medical leave, but they may be entitled to unemployment insurance. To be eligible for the sick leave or the expanded medical leave, there must be work for that employee to do, but the employee cannot do that due to the coronavirus, and they meet the requirements for the paid sick leave or for the expanded medical leave. For the sick leave, the employee has to be either quarantined pursuant to a federal, state, or local government order, or on the advice of a healthcare professional, and or experience COVID-19 symptoms and is seeking a medical diagnosis. But again, the key here is there has to be work for that employee to do. Remember that this new act, the Families First Coronavirus Response Act, only applies to employees with 1 to 499 employees, and to all public employers, regardless of size, except for some federal workers. For the expanded medical leave, employers must not be able to work because they have a child or children under the age of 18 who are at home because the schools or the daycares are closed. And again, employees who have no work to do, who are furloughed or laid off, or even terminated, should consult with the unemployment office in their state to see what the requirements are under the unemployment insurance, which the federal government has provided the states more funding for. So the rules are being expanded as we speak on a statewide basis.
Got it. What all is needed to file for unemployment if they're choosing to due to self-quarantine?
Again, this is going to depend on whether or not they are able to work at home and the advice of the state or local governments as to whether they have been advised to self-quarantine. If that's the case, they may be entitled to the 2-week sick pay and then potentially afterwards, if they have children at home, to the expanded family medical leave. The only ones that needs to be concerned about the unemployment are those employees who are laid off, furloughed, or terminated as there is no work for them to do. And they should always consult with their state's unemployment department to see what they may be entitled to and how to file for that.
All right. What documentation will employees need to provide employers to be eligible for the expanded FMLA?
Okay. The DOL has recently issued clarifications on the documentation as well under the Family First and Coronavirus Response Act. And they say that this is if the employer is seeking the tax credit, which all employers between 1 to 499 should do if they are entitled. The DOL has stated you should retain appropriate documentation in your records. You should consult the Internal Revenue Service's applicable forms, instructions, and information for procedures that must be followed to claim a tax credit. Once those forms come out, then we certainly will share them with you. And then they said, including any need for substantiation to be retained to support the credit. You are not required to provide leave if material sufficient to support the applicable tax credit have not been provided. And again, MedCom will post the forms once they become available from the IRS. But for the sick leave, you have to have information that there is a state, federal, or a quarantine. They're asking you to stay at home or work, or stay at home, and that when you do that, or whether or not you have symptoms, then you would need to get something from your physician that he advised you to stay home. If one of your employees, however, takes the expanded family and medical leave to care for his or her child whose school or place of care is closed, or the child care provider is unavailable to the COVID-19, you may also require your employee to provide you with any additional documentation in support of the leave, to the extent permitted under the certification rules for conventional FMLA leave requests. For example, this could include a notice that has been posted on the government school or daycare website that the school has been closed. This is not going to be difficult. We hear about it every day. We know the schools are closed. So it's not going to be that difficult to get, but that you should keep that documentation. Now, if you are sick due to the coronavirus and you need more than that 2 weeks sick pay, and you're claiming that sickness in addition to the 2 weeks under the extended family medical leave, you're actually requesting it under the regular family medical leave, and all the paperwork that you would normally do remains in effect. For an example, if you were taking leave beyond the 2 weeks of emergency paid sick leave because conditions for the COVID-19 rises to the level of a serious medical condition, you're in the hospital, you're on a vent, or whatever it is, you must continue to provide the medical certifications just as you would under the regular family medical leave or as required by your employer.
Got it. Thank you. If an employer is paying for medical premiums on behalf of an employee while out on layoff, will this impact their ability to file for unemployment?
If they're on layoff and they're not being charged a paid a salary, but the employer is paying for the medical premiums, it should not affect unemployment. But I would always recommend that the employee checks with their unemployment department. But if they are laid off and not receiving a salary, then that should not affect unemployment.
That makes sense. What if there's an employer with employees in numerous states? Would a layoff affect their ability to file for unemployment? Do they file in the state of residence or the state where the company is located?
Generally, and this is generally because there are some exceptions, unemployment is filed with the state where the employee worked. If they work in a state other than the one where they now live, or they worked in multiple states, the state unemployment insurance agency where they now live can provide information about how to fill out the claim with other states. So I always recommend they go to the state of residence, and that resident state will help them determine which state they are actually entitled to unemployment insurance. But it does not affect if the employee has several or numerous states. So tell the employees to go to the state where they live and see if that state can help them fill out the unemployment for the other states as well, or wherever they need to do it.
Are medical FSAs allowed to be increased outside of open enrollment due to the pandemic?
We have not heard any guidance from the IRS on this yet. and we will certainly keep you posted. It's the first time I've heard about an increase. Typically, we're hearing, can they decrease the amount because they can no longer afford to pay the amount. On DCAPs, there's certainly a lot of leeway because the daycares are closed and the government, the statute itself has always provided for that. On the medical FSAs, there has been nothing from the government yet on how to handle FSAs and increases and decreases.
Okay, if a small employer terminated employees due to a lack of work since the pandemic was announced, but prior to the Families First Response Act, are they in jeopardy of violating the act?
Certainly not. If there was a business reason to terminate the employees, i.e. you have no business, you had to close your restaurant, there is certainly no issue. And even if the Response Act had been out, the employees would not be entitled to the sick leave or the expanded medical leave unless there was work for them to do and they are unable to work, even remotely, due to one of the qualifying reasons. When employees are terminated, laid off, or furloughed, they may be entitled to the unemployment insurance. Another thing we do want to mention is that small employers with under 50 employees may be able to request an exemption from the Family First Coronavirus Response Act, but we have not yet been advised as to the rules, and we will keep you posted as to when the DOL publishes those rules. But again, with the tax credits being available, it certainly is worth considering trying to retain your employees and allowing them, if possible, to take advantage of the sick or the expanded family medical leave.
Thanks, Michelle. The IRS has now indicated that over-the-counter medications and menstrual products are now covered under Section 125. Do we have to amend our plan documents for this?
Yeah, typically these are under 105 or 25. And the review of the plan document, the first thing you should do is review the plan documents that you have and how they are written. For an example, a lot of Medcom Benefit Solutions plan documents typically state that this flexible spending account is intended to qualify as a medical reimbursement plan under Code Section 105 and shall be interpreted in a manner consistent with such code section and the Treasury regulations thereunder. Therefore, since the code was adjusted and we administrated according to the code, no real amendment would need to be done at that time. So I do ask the clients to take a look at what their plan documents say, and that will give you a good indication as to whether or not they even need to be adjusted. We are also advising clients that rules are coming down fast and furious, and plan administrators should always document the decisions they are making and why, and mention the coronavirus and their response to the coronavirus. Any plan document changes can be made when appropriate, when all the guidance is issued. What we don't want is confusion if plan documents start being updated as each change comes out and it gets confusing for everyone to determine what to do and potentially even more expensive. So just look at your documents that you have, chart what you're doing and why you're doing it, and then after everything is said and done, would be a good time to determine whether or not anything needs to be updated.
Some insurance carriers are offering a new open enrollment period. Should we be concerned about this?
Yeah, we have heard that some of the insurance carriers are offering a new open enrollment period for those that did not initially sign up at the typical open enrollment period. This really is outside the general guidelines for special enrollment rights. I have heard that the administration is considering a special enrollment right for the marketplace, and I have not heard that they are considering it for private insurance as well, but I believe that it's something that they could very well be considering, and especially with the insurance lobbyists there, that's something that they may be on track to know more than we are. But as of today, there has been nothing out that insurance carriers can hold an open enrollment and that it falls within the government preview. However, Congress and the departments are so busy, they have not thought of everything at this point. we are certainly in uncharted waters, as we have been since this whole coronavirus has come out and has impacted our nation and the world as it has. There is always a chance that, and this is a chance that the plan could lose its cafeteria plan status if they allowed for employees to enroll at a time when the rules are not relaxed. However, the defense to that would always be that we're in a pandemic situation, and certainly it's in the public good to have more people insured rather than less. On the other hand, the government would, as I said, would probably want more people to be insured rather than less. So whether or not the cafeteria rules will be strictly enforced this year remains to be seen. But I imagine the risk is low. However, there's still a risk. The other option is to always allow the employees to roll outside the cafeteria plan, potentially on a post-tax basis, until more guidance comes out. I found it really telling that I did have an email on a completely separate topic that really doesn't ensure that really doesn't concern health plans from CMS. And basically what they said regarding their open payment program, where the reporting is due for that by hospitals and some entities by March 31st, they said that they did not have the authority under the law to extend that March 31st deadline, but they did indicate that they would exercise enforcement discretion. And I really liked that term because I think this year we might go down as a year of enforcement discretion as we try to get all these rules put into place and as the government is trying to decide what to do. And as the Department of Labor and the IRS are writing the rules after the laws come out. So I think that documentation by a plan administrator as to what they did and why is always important. But I do have a feeling that they will exercise more enforcement discretion. But as far as the open enrollments of these plans are concerned, we have no indication right now that the IRS has changed the rules of the special enrollment rights and have opened it up.
Okay, that's kind of the end of our list of questions. We did have something come in, Michelle. I believe we've covered it, but just to clarify on FSA rulings, anything like that, that we really haven't heard anything about runout periods and returning unused funds. So I just want to ask again, can employers return unused funds back to employees so the employees don't forfeit these funds during this pandemic? Do we have any information? I'm not sure that we do.
Well, certainly runout period and runout period is not regulated by the IRS. That's regulated by plan design. So there is a question as to whether or not, because of the plan design and the government doesn't say you have to limit your runout to 90 days, that the employer could potentially expand that runout period just by changing the plan, because it is a plan design, not an IRS rule. Certainly if somebody, the other suggestion always is that if the runout is finished and people did not finish all their monies, the employer could always give it back to the employee on a post-tax basis and be perfectly safe. We're still waiting for clarification as to whether it can be, some of these issues can be resolved pre-tax. But again, runout periods are not governed by the IRS. The employer sets the period of time for that.
Okay, that makes sense. Thanks for clarifying and answering that one kind of on the fly. So that's all the questions that we have for today. But remember that we will be back here on Thursday afternoon at 3 o'clock. So if things are happening between now and then, which we know that they will, please submit your questions to us at COVID-19 questions@medcombenefits.com. Michelle will, get to work on the answers, and we will provide you as much information as possible. We're here to help. We're here to kind of walk us through this really confusing and crazy time that we're going through, trying to figure out everything that's happening for our industry and employers and employees. So thank you again for joining us today. Thank you, Michelle, for tackling all of these questions. And we certainly hope to hear from you and talk to you again in the future. Like I said, you can join us again this Thursday at 3 o'clock. Thank you all so much for being here. Have a wonderful afternoon.
Thank you, Casey.